Monsieur le Président, depuis 2 semaines, les pédiatres ont vu plus de cas de virus respiratoire commun, appelé VRS, qu'ils en ont vu pendant les 3 dernières années. En plus de cela, nous avons une souche de grippe particulièrement virulente qui circule et tout le monde se demande à quoi s'attendre avec la COVID-19 cet hiver. En regardant les nouvelles cette semaine, j'ai vu la médecin hygiéniste en chef fédérale ainsi que les médecins hygiénistes de l'île du Prince-Édouard, de Terre-Neuve, de l'Ontario, de la Saskatchewan et de la Colombie-Britannique s'adresser à leur population. Mais ici, au Nouveau-Brunswick, la santé publique manque à l'appel. Le ministre de la Santé s'engagera-t-il à ce que la santé publique informe les gens du Nouveau-Brunswick de la situation du VRS, de la grippe et de la COVID dans la province au cours de la semaine prochaine?
Minister of Health.
Well, thank you very much. And again, I appreciate the question, trying to, again, provide the information for the opposite members. And on Tuesday, there was a report released, 7 pages, that did not only a provincial scan, but a Canadian-wide scan and an international scan on COVID-19 and some of the other issues that are going forward. And the respiratory RSV is not a reportable disease as COVID-19 or monkeypox or some of the other very contagious diseases are, but things are changing. And I know, again, Dr. Legier actually made a presentation to the FPT meetings last Tuesday in partnership with Dr. Theresa Tam, and it was very well received from the ministers right across and the territories and the province. So, Mr. Speaker, public safety, public health, they continue to be present, they continue to be engaged. Again, I don't control the media availability of individuals such as that.
Minister. The member for Memramcook-Tantramar.
Mr. Speaker, what we're saying is that the public needs to hear directly from public health. What we're saying is that they are absent. We need leadership. Where is it? We need a press conference. When you add on RSV and influenza and COVID to the health human resources crisis we have, there just isn't extra capacity in the system right now. Hospitals across Canada are being overwhelmed by these 3 viruses. Pediatric units in particular are being strained, including here in New Brunswick, Mr. Speaker, where they are at or near capacity. We don't even know, as the minister just said, how many cases of RSV there are in New Brunswick because public health doesn't track it. So, what are public health's projections for hospitalizations from these viruses this winter? And what is public health's plan to protect the most vulnerable and ensure our hospitals aren't completely overwhelmed by the triple threat of RSV, COVID, and flu this winter? We need more than a report. We need a press conference.
Minister of Health.
Well, again, Mr. Speaker, look, more than happy. I'm sure Dr. Legier will be out in the media in the not-too-distant future to alleviate some of the concerns of the members across the way. But there's no secret, Mr. Speaker. We know the triple threat has been headed our way, including various respiratory illnesses like RSV, influenza, typical flu-like system. And the whole system has changed, and that's why we are preparing. Mr. Speaker, we're preparing to make sure that we're recruiting, whether it's healthcare workers, internationally trained nurses, and I know we're adding seats that are along the way. The member opposite is wanting something now and immediate, but again, public health is engaged. I talked about the report. I talked about some of the other initiatives going forward. Message hasn't changed, Mr. Speaker. People need to take the precautions. They need to get vaccinated. They need to wear a mask if they want. They need to wash their hands. They need to cough into their sleeve if need be. So, Mr. Speaker, again, the message is clear. We're prepared. We're working forward.